Hey there, it's Sarah, author, speaker, and advocate, and writer of Narcissistic Abuse, A Survival Guide, which is now available on Amazon.com. So if you've not done so already, please pick up your copy today. I'm going to continue to transition somewhat from narcissistic personality disorder and narcissistic victim syndrome over to post-traumatic stress disorder, which is essentially oftentimes a component of narcissistic victim syndrome. However, it's a more generalized term and can be derived from a variety of circumstances, traumatic events or other things that have happened to us in our lives. So the two are essentially interrelated. And today I want to talk a little bit about kind of managing the symptoms of depression that are associated with post-traumatic stress disorder, why these come about, what they feel like, and what we can do to, kind of move forward to a more healthier state of mind. So post-traumatic stress disorder, as we've already kind of gone over, covers a variety of symptoms that are often a result of experiencing extreme trauma that is very difficult to release even after we've moved away from this particular situation. So, victims often feel anxious and depressed. They have panic attacks, moments of paranoia, flashbacks, nightmares, and different things that are very unpleasant. And one of the most prominent symptoms of post-traumatic stress disorder is depression. So depression affects a large number of people in general, whether or not we have experienced past trauma and are coupling this with PTSD. And it is obviously very unpleasant to always feel down in the dumps with low energy, no desire to do the things that we once partook in or to even, maybe be social at all. So oftentimes those that have clinical depression would rather be by themselves, doing something simple and just relaxing. So while that's okay and actually encouraged and wonderful to do every once in a while, when it's overtaken your priorities and the things that you need to do on a daily basis, then it becomes an issue, right? So what can we do when we experience these feelings? So basically, when we're feeling very, very depressed, which could constitute as clinical depression, we, like I said, have very low energy. We can get body aches and pains. We can get headaches especially, but our whole bodies can ache, and then that gets worse with inactivity. So if we're lying around and we just don't feel motivated to do anything at all, then our body aches are going to get worse, okay? And then the longer that we sit and we kind of wallow in whatever thoughts are running through our head, especially if we are coupling this with PTSD and we're thinking about the past, or we're just, very uncertain about the future and how we're going to move past this state, it can be very, very all-encompassing and all-consuming. So, and the longer we sit with these thoughts, the more depressed we become, because we realize that, we're giving up things that we actually really need to do, daily things that need to get done, and we're not associating with our family and other people in our lives that we love. So, like I said, this can be all-consuming and affect every area of our body, and be extremely life-altering and life-changing. So there are different therapeutic techniques that we can use, and they're very, very simple for the most part, even though there is a lot of psychotherapy techniques and things, and very high-level stuff that counselors and therapists may study. When it all comes down to it, when it's related to the client, related to this individual that is experiencing these symptoms in her life, they are very easily maintained or easily managed at home. So what can we do? We can, first of all, and I just made a video on this, we can practice mindfulness. So that's basically just staying in the present rather than worrying about the past or the future. We don't allow our thoughts to, revert back to who we were in the past and what happened to us. And then we don't allow them to anxiously wander to the future and the uncertainty that lies there. We stick with the present moment. And with mindfulness, there are very, very simple techniques to kind of bring our minds back to the present. So what we can do is we can pick an area in the room that we're sitting in. or we can pick an object. An intricate object is preferred, and we can study this object or study that spot for at least 5 minutes until our mind is completely on the present moment. So you study everything about it, how you're feeling, why it's there, why you're there, what it looks like, every different aspect of it, until your mind is fully in the present moment. Okay, and once we're in the present moment, then we can associate with the feelings that we're feeling in that very moment, and if we're using a technique such as ACT, we can, analyze how we're feeling and what we can do to change what we're doing. So this is slightly different than cognitive behavioral therapy in the fact that with ACT, we kind of disassociate from this being that we don't want to be a part of us, and we focus on our morals and values and as a whole, and then we figure out what we can do to act on our morals and values in order to make a change in our lives. Okay, so the more we focus on the present, the more we focus on living in the moment and what is happening with us right now, the less stress that we eventually have on our plate. Okay, so we're not anxiously always thinking about the past, which we cannot change, and we're not anxiously waiting for the future. Okay, we have to make ourselves healthy and whole and balanced and complete and at peace in the present before we can even worry about the future. So this is also the premise behind a lot of 12-step programs that focus on one day at a time. It's referenced in the Bible, so whatever your spiritual background is, it is a very widespread way of thinking, and mindfulness and ACT come from Buddhist principles as well. So it's just a very widespread way of thinking that if you focus on yourself and you can go inward and you can be at peace with who you are in the present, then you can eventually move forward. Until that time, we're gonna sit in this depressive state because we're overly anxious, we become overwhelmed, and we don't know how to move forward. So that is what we can do. Other things we can do are, journal, meditate, clear our head by taking a walk, which is another great way to focus on the present. Be alone with ourselves in that moment and make sure we can go inward and analyze and see what we need to repair. So I hope that helps you. I know that's a lot. I will try to break all of this down in subsequent videos. And best of luck. Have a great day.